Dr. Phil isn't a licensed doctor, but it's no surprise he has a lot of opinions on how the country should address addiction. He's not a fan of safe consumption sites where people can use drugs under medical supervision.
Talking about, safe places, safe havens, clean needles, it can be taken as an implicit endorsement that this is now safer, that it's okay.
In this episode, he talked to Maya Solovitz, the author of Undoing Drugs. She says the data shows that syringe exchange programs are effective.
People who participate in syringe exchange programs, in prescription heroin programs in Europe, are more likely to get into abstinence or other forms of recovery.
But that argument does not persuade Dr. Phil.
What is the exit strategy? And the answer is there isn't one.
No, that's not true.
It is true. There is not an exit strategy.
Yes, there is.
And of course, Dr. Phil is Dr. Phil, but he's not the only person who feels that way. Instead of punishing people who use drugs or forcing them to quit, harm reduction focuses on reducing the risks of drug use. Solovitz says that philosophy saved her life. During the AIDS crisis in the 1980s, while addicted to heroin and cocaine, she met someone who had some advice.
She told me, I shouldn't share, but if I had to share, I should, clean the works twice with bleach and then twice with water. And she probably saved my life.
In San Francisco, people stocked bleach in corner stores, bars, and taquerias. Advocates also distributed clean needles without permission from the government.
The whole history of harm reduction in the United States and really internationally, it's first things are done illegally and underground, and then the sky doesn't fall.
That's Rachel McLean. Back in the 1990s, she worked as an outreach worker in San Francisco when the city was seeing a wave of heroin overdoses. She was part of the push to distribute Narcan, the medication used to reverse overdoses. McLean still remembers the first time learning about a save.
We call it a save when you give somebody naloxone and then they use it to reverse somebody else's overdose. I can't even describe it. It was just such an incredible feeling of being we're doing it. This is working, We are giving people who use drugs the tool to save each other's lives.
The results were promising.
We're talking about thousands of doses and many lives were saved.
Joshua Bamberger, a professor of medicine at UCSF, was the only physician prescribing naloxone in San Francisco for many years. And the death toll from heroin overdoses plummeted from a peak of 155 in the mid-90s to 10 in 2010. Flash forward to today, fentanyl is killing people in record numbers.
Just when the drug dealers come up with a new drug, we need to come up with a new response. I think it's our job as physicians to give people the tools so they don't come to greater harm from their addiction or their illness. First do no harm, primum non nocere.
Still, despite the overwhelming evidence that safe consumption saves lives, many political leaders are not persuaded. In 2022, California Governor Gavin Newsom vetoed a measure to create a pilot program for safe consumption sites, saying they could have unintended consequences.
The law and order stance that many politicians have learned is a successful position to be in to get elected, is not the stance that science supports.
Bamberger says harm reduction is only controversial when it comes to substance use, perhaps because of our own fear of losing control. So some people might think, well, what's going to get me to do something? And the answer might be consequences. But those threats don't work for people living with addiction.
I think that there's a lot of cultural misappropriation by taking more middle-class values and projecting it onto drug users and assuming that that's going to fit.
And instead of TV pseudo-doctors, we could look to real doctors who study addiction and their results. Since opening safe consumption sites in New York, hundreds of overdoses have been reversed. For Philosophy Talk, I'm Holly Timothy.